The Pregnant Care Show is proudly brought to you by
Spretonic,
Flourish Formula.
PCOS is one of the most common but treatable causes of infertility in women. The hormonal imbalance interferes with the growth and release of eggs from the ovaries. It affects about 6% to 7% of the woman population. PCOS is a hormonal disorder common among women of the reproductive age, and they may have infrequent or prolonged menstrual period or excess male hormones, that is the androgen. It is also a metabolic disorder. Women with PCOS produces higher than normal male hormone. The male hormone makes their bodies to skip the menstrual periods and sometimes make it harder for them to get pregnant. But note that PCOS does not mean a woman cannot get pregnant. Remember, it is very treatable. Welcome to the Pregnancy Care Show. My name is Dede, and the show is brought to you by Spretonic and Flourish. On today's episode, we are looking at PCOS, polycystic ovarian cysts. And on today's episode, we have Dr. McCarthy with us. He's going to take us through everything PCOS. Hello, Dr. McCarthy.
Hello, Lily.
You're welcome once again to the Pregnancy Care Show.
Thank you. It's always been nice.
Okay, so this time around, anything for our viewers again?
Yes, my name is Dr. Michael McCarthy, obstetrician gynecologist, also the CEO of Sinel Specialist Family Hospital here in Tema. And I wish to say that we are celebrating our 40th anniversary this year. And we'll also be reopening our new facility at the end of this month. I'm a specialist in women's health, and Sinel also does pediatrics, takes care of the whole family. That's general surgery, physician specialist, dietetics, and that's very important for today's discussion, and also psychological care of our patients.
Okay, so you are welcome once again. I think we have a party to come.
Yes.
Okay, so
yes.
are we invited anyways?
You are invited, and it's a year-long party, and we're doing different things. We'll help some other health facilities in Tema to acquire some equipment and set them up.
Wow.
And we will outdoor the new services that we are having, and making sure that Tema remains healthy.
Okay, so some free screenings and examination for
Exactly.
me, I guess. Okay, so back to our topic. If it's talk of PCOS, what does that mean?
PCOS is polycystic ovarian syndrome. It is a syndrome, something that is going on in the body that affects women. It's an endocrine issue, a metabolic issue, something that has to do with the hormones and the way they function. It's not just one simple thing that you can say, oh, this is it. It has a number of different facets to it that all come together and make it the syndrome that we are talking about.
Okay, so is it like a collection of something, or?
Yes.
Okay, so who can get PCOS?
Well, so we are describing PCOS as a disease of women because it has to do with the ovary.
Okay.
So, well, any woman can get PCOS, but women who have got higher androgen levels, who have higher weight and so on, are more likely to get that. Some women who have had an earlier first period in life are also more likely to be at risk of PCOS. Yes.
How common is PCOS?
PCOS is the commonest endocrine disorder in women of reproductive age.
Okay.
Somewhere between 5 and 15% of women will have this.
Wow.
Now that is a lot of women and a high percentage, yes.
So should women be worried about this condition?
Yes, it's a condition to be worried about because it's not just something that you see, diagnose and treat and then that's it. It is something like a lifelong companion.
Wow.
to the
scary.
woman. That is scary. That starts at puberty and continues even in the periods after menopause.
What tells a woman has PCOS?
Well, so some of the symptoms of PCOS go with the menstrual cycle. So they have abnormal menstrual cycles, very long periods of no cycles at all. heavy menstrual bleeding or no bleeding at all, or irregular bleeding. Sometimes also the bleeding is too much when it does come, and sometimes too little when it's not coming.
Okay.
So that's one of the big things. You also notice that a good proportion of women, but not all women with PCOS, also have obesity or at least being overweight, and so have issues with body weight.
Okay.
You also have issues of fertility. That will only be seen in those who are trying to get pregnant. But remember, this can start right from the teenage years, where they're having some of these irregular things. And it's difficult to differentiate because naturally, the lady in the late teens already has some challenges with regularity. But then those trying to get pregnant will notice that they are not really getting pregnant. You are not ovulating. There's some hormonal issues and so on. As we go on further in life, then they may start to experience other things as well.
Okay, so I also heard somewhere that it's common among women with lots of hair, probably a woman with beard and all that, she's likely to have PCOS, and women with lots of acne on their faces. I don't know how that is, if there should be a little clarification on that.
There are skin changes. In fact, PCOS seems to affect almost every part of the body.
Okay.
Some of the changes are skin changes, so they may have excessive hair. Not just excessive hair, but excessive hair in certain places like the chest. The upper part of the abdomen, on the thighs, and sometimes facial hair as well, both at the beard part and the mustache part. But it doesn't mean that if anybody who has more hair has PCOS, no.
Oh, okay.
But there is that association with that because there are increased levels of the male hormone, which would then cause the male type of hair distribution. You know, so yes, skin changes. Also with acne, they may be more at risk of getting acne, and that can be on the face, can be on the chest, can be on the back, and that can be quite troublesome.
Okay, so does that mean that as women we have some level of male hormones?
Yes, both men and women have the same types of hormones in their bodies.
Okay.
Okay, it is an issue of proportion. How much estrogen does a man have? How much testosterone does a woman have? And so there are the normal ranges for all of us to be normal. And so when this is disrupted and there is a bit more than should be, then you get some of these issues. So in the situation of polycystic ovary syndrome, you have more of the male type hormones, and so that pushes the system a little bit out of gear. You also have a disproportion of some of the hormones like LH and FSH.
Okay.
The proportions are reversed. And these things then have the effect of not allowing ovulation to occur as regularly as it should, and then that leads to some of the other problems.
So how is PCOS diagnosed medically?
So PCOS is first diagnosed by the medical history and physical examination.
Okay.
What has the woman been going through? What are the issues? And all the issues I've discussed may be happening. And then also looking at the physical features of the woman that we have discussed. But remember, there are other conditions that can look similar. And so laboratory testing is also then warranted, though that is not necessarily the key diagnostic point.
Okay.
But laboratory investigations are important to see the levels of some of the hormones, eliminate some of the other conditions. Also, one of the things that is quite important is how the ovaries of the woman look like. And here I want to spend a little bit of time talking about that because sometimes there is misunderstanding. PCOS, polycystic ovary, so I have ovarian cysts. No, it's not like that. We have another condition called ovarian cyst. And an ovarian cyst is usually a cystic lesion of the ovary that has a certain size. Usually it's more than 5 centimeters, 6 centimeters in the woman who is of reproductive age, or if it's more than 4 centimeters in the one after menopause. Now that's about this size, right?
Okay.
That's about 4 to 6 centimeters, I believe. So that is big, right? And that is an ovarian cyst. And they can even be bigger. They can be huge, really huge, but I'm giving minimum size. When you talk about PCOS, the ovarian changes, where we say we have cysts in the ovary, it's not like the way we have an ovarian cyst. They are actually not cysts. They are actually follicles. So maybe we should call it polyfollicle ovarian syndrome to be maybe a little bit more accurate, because here we're talking about follicles that are about 10 to 15 millimeters in size. And you have multiple of these very much smaller ones arranged within the ovary. Okay, and they're almost about the same size throughout. I'll tell you why that is important to note. So you have an ultrasound scan of the ovary, and you see this ovary a little bit larger than normal, and with these small 10 to 12, 15 millimeter follicles arranged all over the ovary. That appearance of the ovary is called the polycystic ovary, even though those are not cysts, but they're actually follicles. So what is happening is that in a normal ovary, you have these follicles of different sizes within the ovary. So you would have a smaller one, you have something a bit larger, and then you have one that's just about to ovulate. And every month, one of them will ovulate, then more are recruited, and so on. In the situation of polycystic ovary syndrome, or PCOS type of ovary, the follicles don't develop past a certain stage, and so they get stuck. At that point, it gets stuck there, and that's it. The next one comes, also gets stuck there. So by the time a number of years have passed, you see they are all arranged in there, they are all stuck, they're not able to progress. And so they are not ovulating. And that is why you have that appearance going on. And that has to do with the hormonal changes and so on. So to diagnose your history, your physical examination, laboratory testing of some of the things, both to diagnose and to eliminate, and then the ultrasound findings to have a look at how do the ovaries look like.
Wow, that's quite deep. So do we have some type of women that are prone to this condition, or is just general? Anybody could get it or anything?
Yes, I mean, once you are at risk of this, or you are prone to this from your genetic makeup, then you can go on to develop it. And you may not even know that early. But those who have been exposed to androgens earlier, maybe having an earlier menarche, or exposed to some kind of male hormones in the uterus and so on, will have some of these predispositions. Yes.
So,
sometimes even your birth weight
could affect.
Yes, if you're too below the average weight of low birth weight, or higher birth weight, over 4.5, then that puts you also at risk. And unfortunately, you can't do too much about your birth weight.
So remember that PCOS is a lifelong issue, but then it is also manageable for you to get pregnant. Remember as well, PCOS is not infertility. We'll go for a short commercial break. When we come back, we'll find out more on PCOS and take some questions from our viewers.
Flourish Formula is a liquid herbal iron extract
with the benefits of organic iron 3 polymaltose plus vitamin C and other B-complex vitamin, the base of fruit juices and yeast.
Flourish Formula helps increase your energy level, stamina, and highly nutritional, and also reduces tiredness and fatigue. It contains vitamin B1, B2, B6, B12, and C. Flourish Formula helps keep the family smart, healthy, and strong. For enquiries, contact Unicom Chemist Limited on 0302 324 595 or 0302 324 383. You can also email unicomchemist@yahoo.com or visit www.unicomchemist.com. This advert is FDA approved.
Welcome back. If you just joined us, it's the Pregnancy Care Show, and we are looking at PCOS. So we have Dr. McCarthy with us today. He's taking us through everything you have to know about PCOS. So what are the main causes of PCOS?
So PCOS again is genetic. So you have this genetic component that makes the body go through some of those things, and then aggravated by diet, lifestyle issues, and so on.
Is it treated or manageable?
I must say that this is maybe the key and the core question that you have asked now.
Okay.
And if listeners forget anything, if this is what you should put on your IG page, that the issue of PCOS is that it's a lifelong issue. And so you not say, well, I've been trying to get my periods and now they've given me some medication, my period has come, so my PCOS is sorted. It's not. PCOS goes from the late teens to the 20s, 30s, 40s, even post menopausal can have its repercussions. So you are right in saying that we are managing the situation, understanding what is going on, looking at the life phase that the patient is in and managing it within that time.
Okay, so can it be prevented as well? Probably from the early stage. Do we have factors or something that could be done to prevent one from getting a PCOS?
Well, you can't really change the genetic things that are going on.
Sure.
But you can start thinking about managing weight, diet, exercise and so on to help to start to control it. But that is not really prevention of the disease, but maybe secondary prevention of the consequences of the syndrome.
Okay, so can PCOS affect a woman's pregnancy rate?
Yes. So one of the features of polycystic ovary syndrome is the fact that it affects fertility, usually by causing anovulation or not allowing ovulation to occur at all or as regularly as it should, and therefore that will affect fertility.
So is PCOS infertility?
It is one of the causes of infertility, yes.
So should there be a lifestyle women should adopt or practice to reduce the risk of getting a PCOS? I think you've even said something like that, but maybe you can give us a little more insight to that.
Yes, you see, polycystic ovary syndrome affects women at different ages differently. So take, for example, somebody who is in the early 20s with polycystic ovary syndrome. Maybe she's not interested at that time in getting pregnant, but she's interested in regulating her periods. And so that patient would benefit from management or treatment of her period so that she can get her periods at certain intervals. The one who is then within the space where she wants to get pregnant, she's just married, she wants to start her family and so on, will then be treated with medications to help her to ovulate, and interventions like that. For the older one who has maybe completed her family, she may be looking at preventing some of the long-term complications, hypertension, obesity, diabetes, type 2 diabetes, cancer of the uterine lining, and so on. So she may want to adopt a lifestyle pattern that will help to change that. So you need to understand where the woman is at and then put in the kinds of treatment that will help to address the issue at that point. Some of the general things are, one, to look at your body weight. It may not be that easy to lose weight. Gaining weight is much easier, it seems, than losing weight for some people. And so that may be one of the things we can look at. How can I manage my weight to be within a certain range to reduce the longer term complications? In fact, sometimes we even use weight loss to treat the anovulation and the infertility, where if a woman can lose about 10% of her body weight at that point, that alone may be enough to cause the body to start ovulating again. So weight loss is an excellent way. Looking at your diet also, of course we have dietitians who would then help with that. Making sure that you're on a healthier diet in order to manage both the weight and then also having a healthy diet for your reproductive system. The other part, of course, is also exercise. Remember, I didn't mention that, but one of the things that happens with polycystic ovary syndrome is that there is abnormal functioning of the insulin in the body, and insulin controls weight, controls blood sugar, and so on. And so exercise and building muscle mass helps insulin to work better. And then that may also in turn help polycystic syndrome to work.
Okay, so should I see a fertility doctor if I'm diagnosed with PCOS?
Definitely. It's a complicated situation, and needs to be addressed as such. And yes, endocrinologists and fertility doctors like gynecologists are the people to see.
Okay, so can management fail? For probably I have a PCOS and I want to get pregnant, so I'm being managed or treated. Can it fail?
Yes, I mean, it's a process. It does take some time and you need to follow up with your treatment. So for example, we are getting you to lose weight and you're not losing weight. What's the reason? Maybe the dietitian will find a reason. Or maybe you've been able to lose weight, you're still not ovulating. We decided to put you on some medication. One needs to monitor whether the dosage of that medication was adequate to cause ovulation, and you may have to increase the dose. And so it's dynamic and we go along. Yes.
Okay. So remember that maintaining a healthy weight and eating well, exercising are very important to the life of a woman. We'll go to our social media handles and take some questions from there. So these are some questions from our social media handles from our viewers. So if you want to know, can PCOS cause miscarriage?
Not really. It will cause prevention of pregnancy.
Okay, right.
But sometimes the issues of insulin metabolism and so on can affect the early pregnancy and cause a miscarriage.
Okay, so...
And the obesity as well.
Okay, so in PCOS, there's an issue with insulin control, and that could have effects on the pregnancy, if I understand what... Yes. You are saying. Okay, so our next viewer is asking, are there any complications of PCOS since it's not treatable and you have to live with it for a longer time? Are there any complications to it?
Yes, yes. So the let's talk about it as long-term complications. The long-term complications go with the obesity, go with diabetes, hypertension, and cancer, especially cancer of the uterus.
Okay.
Those long-term complications, which are very serious.
Okay, so our next viewer is asking, can I get pregnant whilst I don't have my menses?
Yes, you can get pregnant if you're not having your menses. As long as you ovulate, you can achieve a pregnancy. Because even though the patients with the women with polycystic ovary syndrome may not be ovulating, it does not mean that they don't ovulate all the time. Sometimes they actually do ovulate occasionally.
Okay.
And so at that point, she could get pregnant.
Okay. Our last comment is, if my PCOS was treated before I got pregnant, should I treat it again when I'm ready to conceive again?
All right. I'm sure that question has been answered for the person if she has been listening very carefully. The thing is that you are only solving the problem at the time that you are intervening. You're not solving it completely into the long term. You need to continue. So if you are managing your weight, if you're managing the glucose control, then that's something you're going to be managing into the future. Not just at that time, oh, I solved it and I got pregnant, so I'm fine. You're not fine. You still have that issue. And that is why I told you that was the most important question you asked. You don't treat it and solve it at that point. It's something that is lifelong and you need to manage it as such as well.
Okay. So make sure you are adherent to every treatment of PCOS. We'll go for a short commercial break. When we come back, Dr. Michael will give us his final words on PCOS.
Yo, Kojo, you look happy and strong.
Yeah, Charlie. But I couldn't have done it without you, you know. Madam was always complaining. But ever since you introduced me to Spertonic, life has been good.
Spertonic helps boost the immune system, fitness level, and performance. A tablet a day is all you need, man.
Spertonic. Strong as a wood. For inquiries, contact Unicom Chemist Limited on 0302 324595 or 0302 324383. Email info@unicomchemist.com.
Spertonic is not suitable for persons under 18. This advert is FDA approved.
Are you a mother? Are you trying to conceive? Have you had challenges with conception? Do you have a story to share? We are dedicated to helping you solve your problems. Join us on your favorite pregnancy care show and share your experiences with us.
In my first pregnancy, I expected that my body would go through some changes. Yes, and then at the end of the changes, I was expecting to deliver a baby safely.
Remember, sharing is caring, and your experience will encourage and help someone. Contact us on 050-166-1330 or send a message to all our social media platforms at The Pregnancy Care Show, and we will get back to you.
Welcome back. You just joined us. It's still the Pregnancy Care Show, and we are looking at PCOS. So, Dr. Michael, what is your final words on PCOS to our viewers? Any advice, anything you want to tell our viewers?
Polycystic ovary syndrome is the commonest endocrine disorder for women and needs to be managed carefully and comprehensively. So that would involve the dietitian, the endocrinologist, the gynecologist, psychologists, and so on. So seek help and realize that there is a lot that can be done to address this issue.
Okay, so thank you very much, Dr. Michael,
You're
coming
welcome.
on today's episode.
Thanks for having me.
Okay, so let's look at some tips on how to manage PCOS. Try to maintain a healthy weight by exercising. Avoid eating junk or unhealthy foods and stay active always. Limit your carbohydrate consumption and eat healthy. Reduce alcohol and caffeine intake. Thank you for watching this week's episode. On today's episode, we looked at PCOS, Polycystic Ovarian Syndrome. And we've learned that it happens when the male hormone in a female is more than usual. But then remember, it is manageable, so do not be afraid. It is not infertility. It does not cause infertility, but do what to get it treated as soon as possible. Thank you for watching today's episode. If you have any comments, you have any questions, leave them on all our social media handles and keep subscribing to our YouTube channel at The Pregnancy Care Show. Keep following me on my personal IG page at @dede_gawu. The show was brought to you by Flora Dish and Spetonic. See you next week.